जिनके पास लिंक है वहाँ जा रहा है।
जी सर।
तो मेडिकल एजुकेशन में भी जा रहा है?
नहीं, स्टूडेंट ही।
सिर्फ स्टूडेंट्स को है लिंक।
जी सर। कर लो स्टार्ट।
आप कह रहे थे नेक्स्ट स्लाइड करने के लिए तो ये एरोज है।
जी सर।
ठीक है, कौन सा ये एरो करें तो अगली स्लाइड
है सर, आप ये वाला करना है।
और ये है। अच्छा अच्छा,
ये दो
इधर से नीचे, इधर से ऐसे स्टूडेंट्स हैं।
स्टूडेंट अभी सर 9 आए।
पता कैसे चल
सर ये आना शुरू हो गया,
ऊपर से आना शुरू हो गया।
टाइम तो है वो इधर आ। ये तो बैठा हुआ कहाँ है? यहाँ भी बैठा है, वहीं आ रही स्क्रीन या कैमरा?
नहीं सर, ये डीपी किस तरह प्रोफाइल के ऊपर पिक्चर नहीं करता।
वो लगाएंगे।
इनको कह देना कि अपने माइक और कैमरे ऑन कर।
आपने क्या कहना कि सारे
अभी आए ही नहीं। अगर माइक और कैमरे में ऑन करवा दूं तो उनके कैमरे आ जाएंगे।
सर इधर लाइव वीडियो आ जाएगी।
अच्छा ठीक है। और कैमरा और जो आपका नाम भी आ जाता है साथ ही लिखा। अभी तो नहीं ना जा रहा, अभी तो नहीं जा रहा ना, अभी तो मैंने आपसे बातें। तो ये इनकी तस्वीरें मैंने, अगर मैं कहूँ ला कैमरा ऑन करते हैं
सर। हाँ जी।
हो गया था
जी। 13 बज गया।
बिस्मिल्लाहिर्रहमानिर्रहीम। रब्बि इश्रह ली सदरी व यस्सिर ली अमरी वाहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। Dear students, I just want to give two instructions to you before I start the subject. That the subject is liver. The instructions are: number one, you just put your cameras live so that I can see you and I can talk to you. Number two, you can unmute your voice. Number three, do not disturb between the lecture. And number four, in between, I will put a question in the comment box and you have to answer, maybe 2 times or 3 times. And based on that, you will be marked present. Otherwise, if there is no answer, you will not be marked present. All of you got it? Sabne unmute kiya. I said unmute your. Well, I said to you, unmute yourself and put your camera on live. Well, I can just see 22013, nobody else. Comment box कौन सा? Comment box होता है, comment box. Live just
34 स्टूडेंट अभी लाइव, लेकिन कैमरा किसी सिर्फ एक स्टूडेंट है।
Well, Anusha, I'm grateful to you. You have put your camera live. So I request all of the students that they should put their camera on live and they unmute their devices.
साथ start करें।
एक और नहीं बचा।
Chalo. Okay, we will start this the topic. ठीक है. Well, this is a new topic, and that is hepatology or liver or diseases of liver. When we say liver, it's an organ, it's a very huge organ, having millions of, you already know it, that it has got millions of lobules. So the lobules, we'll talk about that a little later, but this liver as so when you are a student of pathology, we will talk about the liver diseases, and the liver diseases are, the pattern of liver diseases simply means any problem which occurs, which can lead to a disease of liver. It may be an intracellular, it may be because of an intracellular or hepatocyte accumulation of some metabolite in the hepatocytes, or it may lead to an inflammatory process in the liver. That inflammatory process, the pattern or the sequence of pathology is that may lead to necrosis or apoptosis, or if there is necrosis, there will be fibrosis, but if the necrosis is not there, it's only inflammation, it may resolve. Well, it's a very huge organ, and the interesting thing is, you might have heard that if there is a liver transplantation, the donor's liver will regenerate. So there will be no problem with the donation of, if you son wants to donate his or liver to his father, so his liver, portion of liver is taken and he becomes the donor. If there is a tissue matching, can be transplanted to the father. So the donor's liver regenerates automatically, and again it becomes the same size. So it has got a unique property that, for example, brain cells or nerves, they do not regenerate, but regeneration of hepatocytes is here. This is the one of the blessing or the property. But the pathology is, whatever the reason is, it may be only inflammation, or it may go up to fibrosis. Even there could be metaplasia leading to formation of a mass in the liver, you call it hepatocellular carcinoma. So anything, any injury to the liver cell can lead either to either of these, or it may regenerate, it may lead to fibrosis, whatever it is. Final result may be cirrhosis, or it may be vessel carcinoma. Sometimes there is hepatic failure of liver. You call it end-stage liver disease, and there is a failure of functions of liver. The portal hypertension is also, the patient may develop portal hypertension, and because of portal hypertension, there could be the consequences of portal hypertension. Those liver diseases, important thing is, if you want to classify just for the sake of understanding of, as it's a big organ, there could be many diseases in the liver. So as a student of pathology, at least you should learn few of them, and that is, one is jaundice. What is the jaundice? It's not a disease, it is a symptom. So the patient presents with yellowness of sclera or skin. So that pigmentation, yellow pigmentation, when you examine the sclera of a patient, or there is yellow coloration of the skin of a patient, or the patient may give you a history of that he is passing dark color urine or stool. So this yellow pigmentation, or the presentation of patient with dark color urine or stool, they are called, that is the word jaundice. So jaundice is just yellowish discoloration. Cholestasis means stasis in the bile duct. So you know where are the bile ducts? Bile duct, intrahepatic bile ducts and extrahepatic. So this should not be called a disease, but this is the presentation of the disease process going on in the liver. And yeah, hepatitis, you call it a disease. Wherever the word itis is, that means an inflammatory process. So inflammation of hepatocyte you call hepatitis, and that inflammation could be because of many reasons. And the more common are infective hepatitis. So infective hepatitis, usually it is the viral hepatitis, different viruses, and rather we call them the viruses causing hepatitis. For example, hepatitis A virus. You name them rather with hepatitis. Hepatitis A virus means the virus which is given the name A causing hepatitis. Hepatitis B virus, hepatitis C virus. These are the three more common: hepatitis delta virus and hepatitis E virus. So people, usually you will find 5 names sometimes, but more commonly are A, B, and C. Some are foodborne, some are they are transmitted through blood, so you call them bloodborne. So you can categorize them, but this is the most important aspect of liver disease, that viruses, they can cause hepatitis, and different viruses I have given the name. So if you exclude this, the hepatitis can be non-infective as well. For example, it may be autoimmune hepatitis. Alcohol can cause hepatitis. It's a toxin. So we are lucky that we Muslims, we don't use alcohol in our country, but globally, worldwide, people, they use alcohol. We will talk about it in our next sessions as well. But so alcohol and certain drugs. For example, Minofen, another drug is anti-tuberculosis treatments, chemotherapeutic drugs. So they can also lead, sometimes even the NSAIDs or non-inflammatory, those drugs which are non-inflammatory, and for example, paracetamol, even Prof. So these are the drugs, they can also cause hepatitis. The second commonest cause of hepatitis after viral hepatitis is drug-induced. In our country, it's alcoholic hepatitis. We don't have much cases of alcoholic hepatitis, but non-infective, amongst the non-infective causes, autoimmune, alcohol, drug, the toxin, they can lead to. I talked that there could be intracellular accumulations, and so you call them non-alcoholic or non-drug induced hepatitis. So when you say the word viral, the second thing is alcoholic or non-alcoholic. Alcoholic, in that category, you may include drugs or you may separate it, but the mechanism of production of hepatitis is the same. Well, non-alcoholic, I told you that accumulations, intracellular accumulations, you know very well that liver is responsible for a lot of metabolic activity. Some books, they give the name as metabolic hepatitis. And from metabolic hepatitis, some they give different names. For example, fatty liver hepatitis or hepatitis secondary to fatty liver. What does it mean? It means accumulation of various fats in the cell. So fatty liver can lead to hepatitis, it can lead to cirrhosis, although very rare. But most of the time, fatty liver of the hepatocytes having fat, they can also lead to hepatitis and cirrhosis, although less common. The other accumulations are iron. That is called hemochromatosis. Some people, they give the name hemochromatosis. The second name is pigment hepatitis. So pigment, this is an iron pigment which is deposited, although the other pigment also is copper. The second disease is copper pigmentation. And when copper gets deposited or trapped into the hepatocytes, we call it Wilson's disease. So Wilson disease and hemochromatosis, these are the two types of pigments which are deposited in the hepatocytes, and they can also cause hepatitis. Well, I already talked to you about fatty acid. The other is alpha-1 antitrypsin deficiency, liver disease. So I use the word alpha-1 antitrypsin deficiency, liver disease. So it also causes hepatitis. Alpha-1 antitrypsin is a protein, and you know that protein has got a tendency of folding. And when it is a little folded, it is not being excreted. Remember this, and alpha-1 antitrypsin is a very important protein which protects your alveoli, your lungs. But it is being synthesized and or secreted by the hepatocytes. If the protein is abnormally folded, it cannot be excreted, it gets trapped in the hepatocytes. So when it gets trapped in the hepatocytes, that can also cause hepatitis. So you can enumerate all these as the metabolic hepatitis. Although it's, for example, this pigment cirrhosis or hemochromatosis is because of the deposition of iron in the hepatocyte. So obviously, this is a metabolite, iron. Same is, so it is related to metabolism of iron, whether there is an iron load or the excretion from the liver is not there, whatever we will talk about it later. Same is the true with copper. So copper is also a metabolite. So when you call metabolic, you can include fatty liver, you can say Wilson disease, you can include hemochromatosis, and even you can include alpha-1 antitrypsin because it's a protein. So the metabolic hepatitis, you can name them. So these are their different names. I'm just giving you the introduction. Well, if you just stop talking for a moment about hepatitis, the other diseases of liver are, as you know, when you talk about the anatomy a little later, I just want to give a revision of that, a little time for that. But the biliary glanduli and ducts are there. So they put the cirrhosis of bile ducts, or you call primary biliary cirrhosis, secondary biliary cirrhosis, cholangitis. So these are the diseases which are diseases of the biliary tract, which is present in the liver. So the biliary tract diseases, well, the circulatory disorders, shunt, this portal hypertension, and the shunt. Finally, you can say, as I told you, that these events of the pathological events, they can lead to cirrhosis, hepatic failure, hepatocellular carcinoma, if there is a metaplasia. So these are the sequelae, or you can call them as consequences or the end stage. So as the chronicity is there, if there is hepatitis, either it gets resolved, or if the inflammation does not get resolved, it leads to, if there is no regeneration, then what can happen? It can happen, the inflammatory process can lead to necrosis, and necrosis, when there is a necrosis, you know, the dead and dying hepatocytes, there is fibroblastic proliferation leading to fibrosis. That, when the fibrotic element is more in the liver, remember, these hepatocytes, when they are alive, if there is a damage or the inflammation, there is a release of enzymes, transaminases. We'll talk about it also. But once the inflammation is over, there could be complete recovery or regeneration. Even it can happen in hepatitis B, for example. Many patients, you may find in the ward that they are carriers. And hepatitis B carriers, the virus is there, but it is not producing any inflammatory process. So the patient is a carrier. In that case, there is no inflammatory process. But the time may come Maybe after years, it's silent, but after many, many months or a year, it can lead to hepatitis and fulminating hepatitis. So obviously, the injurious agent is there that can lead to disease. The other is secondary liver diseases, or which are not present in the liver, but they are outside, or extra hepatic liver problems. So you can have those. Yeah. So are you getting me? Any question up till now you want to ask? No? All of you are
No,
listening?
sir. Thank you.
Okay, proceed now. Well, how do you evaluate that the person is having liver disease? Suppose there is a patient who comes to you in your ward or in OPD. It's not the only, the patient may be asymptomatic. As in corona, we also see that number of cases are asymptomatic. So in every disease, sometimes the patient does not have symptoms. Rather, symptoms are blessing. So when there is a pain, it's said that the pain is a blessing. Similarly, swelling, that is a blessing. So symptoms means the characteristics which patient comes to you and tell you. That is the presentation of a disease. So if the patient knows it, that I have got pain here, that means the pain is helping you to reach a diagnosis. More difficult to reach on a diagnosis in asymptomatic cases. So patient of liver disease may be asymptomatic or may present with various problems. As I told you, one of the common is jaundice. Well, this I have given yellow color to the block. So you can, if you remember this block, you can say it is just the yellowish discoloration. Usually when the question is asked in the viva voce examination, most of the students, when they are asked what is jaundice, they start telling hepatitis. Hepatitis is different. Jaundice is just a symptom. That means yellowish discoloration. And where eyes, skin, changes in the color of the stool, changes in the color of the urine, and you know this, what is the word? Tarry, tar-colored stool. Why it is tar is the word which is coming from coal tar, that is black. So why the color of the stool is black? You know it, I'm sure. There is no need to tell you that blood, when it changes its color, finally it becomes black. So when more time is passed, the color becomes black. So the patient may come, you must take the history, whether is there any history of previous infection? For example, have you got the history of hepatitis A virus in your family? A virus usually is seen in children when they bring this virus from the schools by eating. I told you it is foodborne by eating or drinking unhygienic food or water which is having A virus. So it runs in the school, it runs in the class. When a child brings it to home, he can transfer it from urine or stool to the other baby or brother or sibling, sister or. So you must take the history. Similarly, in blood-borne diseases like hepatitis B virus, C virus, you must take the history whether any of the family member has got it, whether it is horizontal transmission or vertical from the parents to the children. So you must take the history of family history, personal history. Other is you must take the history whether one has blood transfusion. So what happens in the blood transfusions? So if a patient has already admitted in the hospital and is receiving a blood, so what happens is, in fact, that blood of donor may be having virus. And that virus, for example, if hepatitis B virus is a donor, he is a carrier or she is a carrier. But once the carrier, if the test is not done before there is always a transfusional protocol. So before you transfuse or give a transfusion or take a blood from donor, you have to screen the blood for certain investigation like hepatitis B, hepatitis C. No need of hepatitis A because it is foodborne. So any disease which is HIV transmitted from the blood, syphilis. So certain tests you have to perform of the donor before you cross-match, go for a cross-match. Cross-match means the matching of the blood of donor and the recipient. So before blood transfusion, the step is cross-matching. And before cross-matching, you have to screen the blood of donor from certain diseases. So if one of the cause of hepatitis, you must take the history, whether the patient had transfusion or drugs or alcohol. So this is history number one. After history, you have to ask the problem to the patient. What problems the patient has got. Patient may tell you that there is abdominal pain and the site most commonly, as you know, where is the liver. So it's the right hypochondrium, where is commonly the pain is there. So there may be hepatomegaly, but patient will not tell you that there is hepatomegaly. It is the sign you have to elicit. The doctor has to elicit. That is called the sign. Anorexia, loss of appetite, nausea, vomiting, itchy skin, pruritus, weight loss. So patient may only come to you that he is losing weight. So imagine if you are just being told that the patient, from the patient, you are getting the word that he is losing weight. What can you think about that? Obviously, it becomes more difficult for you. There is a long list of causes of weight loss. But when there is anorexia, nausea, so single symptom or a battery of inflammation. So more symptoms are there, better understanding you can have. You can more easily have an access to the provisional diagnosis of the patient. So there may be in bruising. The patient says that once he or she tries to scratch the skin, there is bruising. Bleeding. Sometimes the patient comes with hematemesis and tells you that he has got bleeding from mouth, or may tell you that there is blood in the stool, or the stool color is black, or the urine is very dark. So there may be ascites. What is ascites? Okay. Anyone? Ahmed Hassan, 22005. What is ascites?
So it is the accumulation of the fluid in the abdominal cavity.
Abdominal cavity is a big cavity. The peritoneum, don't say abdominal cavity. So remember, you have to choose your word which are the best words. Accumulation of fluid in the peritoneum, between the two membranes of the peritoneum. Abdominal cavity means the cavity is containing all the organs. So the better word you can say. It's not very wrong if you say abdominal cavity, because abdominal cavity has only peritoneum, the 2 layers of peritoneum. So you are right, but better it is if you say the accumulation of peritoneum. For example, in the pleural cavity, you cannot call it in the lungs. So there is a difference between accumulation of fluid in the lungs and fluid in the pleural cavity. So, synovium, pleural cavity, in the cerebrospinal membrane. So these are the two membranes, and between that there is fluid. So that is ascites. The patient may come with the symptom of ascites, or ascites may be prominent, that the patient may tell you that there is fluid, but sometimes if it is mild ascites, then you have to elicit it. That becomes a sign then. The patient sometimes comes to the emergency with coma, hepatic coma, or hepatic encephalopathy. And sometimes when you examine the patient, you find that it's large. So history, then symptoms, and then signs, and then comes the laboratory investigation. So you have some idea about this may be a disease. For example, if you from history you think any of one symptom or more than one symptom, or some history or some signs, you have an idea that the patient is having it. What to do now? Obviously, when you have suspect that the patient is having liver disease, what do you think you do? You perform liver function tests. Well, when I say liver function test, that means the functions which liver performs. So what are the functions which liver performs? From the knowledge of your physiology, the LIBA, you tell me, LIBA's are you. What are the different functions a liver performs?
सर मेटाबॉलिज्म में डिटॉक्सिफिकेशन करता है लिवर,
Right?
बिलिरुबिन सिक्रीट करता है,
Bilirubin excrete. There's a difference between
Excrete.
secretion and excretion.
यस सर,
So I have
Excretion
already
better.
said to you, you should very carefully use the words, not only in medical science, rather whenever you're talking to anyone, words are very important. And once the words are out of your mouth, they are not yours. It becomes the property of others. This is saying of Hazrat Ali. पास आपके अपने होते हैं जब तक जुबान के अंदर रहें, जब वो बाहर चले जाते हैं वो आपके नहीं रहते, वो दूसरा. So secretion is different, excretion is different. Okay? So
Yes,
you told me that metabolic function, excretory function, and what else?
Metabolism of the
Detoxification and
detoxification,
one very important thing is synthetic.
biotransformation.
It synthesizes many things. So we'll talk about it. Unless and until you know the physiology, you cannot have good idea about what liver functions are. For example, liver function test. When you write as a house officer or as a registrar, LFTs. Usually in our society, it is taken that you're asking for bilirubin, maybe a total bilirubin, conjugated or unconjugated bilirubin, types of bilirubin, and transaminases, maybe ALT, AST, or gamma GT, alkaline phosphatase. So these are the usual concepts of LFTs. You tell me, is transaminase
Can't hear you, sir.
सर आपकी आवाज नहीं आ रही.
सर आपकी आवाज नहीं आ रही.
आप बोलिए
Uh, uh,
आवाज आ रही है हमारी?
जी सर अब आ
हाँ
रही
जी,
है।
हाँ जी, अब आ रही है आवाज।
Yes.
okay. I'm sorry for the inconvenience and interruption. It was from the back end impact. I'm so sorry. I hope now you are listening to me. Laiba, are you listening to me?
Yes, sir.
Okay. So we're talking that I tell you one thing. For any disease process, you need to know the structure, that is anatomy, and you need to know the functions. Either there is some structural change, which usually you can see it under the microscope after FNA or with biopsy or histopathology, you call it, or histology. Functional, this disordered functions obviously are easily reflected in the blood or in other biological things. So physiology is very important topic. It has to be integrated with pathology and then to medicine. So you can have a good knowledge of medicine if you have good knowledge of physiology. यही वजह है कि आपको बाहर के एग्जाम्स जब देने पड़ते हैं तो यूजुअली दी एनाटॉमी फिजियोलॉजी बायोकेमिस्ट्री वगैरह पहले पढ़ते हैं उसके बाद so now I'm sure I won't waste more time. I just will tell you that there are two types of model in the hexagon. This is liver and this is the lobule. So lobule, there are millions of lobules that are in the form of hexagon. Hexagon means 6 corners. This is a central vein and this is portal triad. I won't go into the details. And the central veins, the hepatocytes, they radiate from central vein towards the portal triads. Between the hepatocytes or the sheets or between the plates, you can call it, the hepatocytes, there are sinusoids, reticular endothelial cells, and Kupffer cells. Bile flows from portal triads to the central vein and blood flows in the opposite direction. I won't go into more detail, but this is, well, if I finish it over here, or maybe after 2-3 minutes, I just gave you, I will take only a minute. Come prepared with the functions of liver tomorrow. Okay, we will have more interactive session. It was very neatly told that there is synthetic function, so you should know what does it synthesize. Because if the hepatocytes are disturbed, or there is a damage, or there is an injury, the functions are altered. So what are the synthetic functions which are altered? And you can find them in the biochemistry or the blood when you examine it. The other metabolic function, for example, it's a huge organ. I gave you an hint. It's a metabolic metabolism of glucose. So do you think that if there is an injury to liver, there is a disturbance in the glucose metabolism, the patient becomes diabetic or hypoglycemic? No, not in acute conditions. Maybe at a very late stage when the patient goes into coma. So a patient goes into coma because of less supply of glucose to the brain. So that means, well, when there is hypoglycemia, but hypoglycemia is a sign in the end stage liver disease. It's never seen in acute hepatitis. Hypoglycemia. Similarly, but I told you that it has got something to do with lipogenesis. That can take you to fatty liver, and fatty liver fat is toxic for the hepatocyte, can cause damage or disruption or rupture, whatever injury you can call it. Proteins, not all proteins, coagulation factors. So synthetic factors. So metabolic, synthetic excretory. अभी तक जो मैंने बात की लिवर फंक्शन टेस्ट कहा जाता है when house officer or a registrar will ask the laboratory for liver function tests, तो most of the laboratories they count 4. तो वो जो 4 टेस्ट हैं उनमें तो excretory function सिर्फ bilirubin है, बाकी तो enzymes हैं, they are released from the hepatocytes due to inflammatory process. Alkaline phosphatase is released from the epithelium of the biliary canaliculi. Once there is an obstruction, whether it is an intrahepatic obstruction or extrahepatic. So again, gamma GT is an enzyme that is also released in alcoholic hepatitis. So, but those are not the functions. The only function is the excretory function. So we have to depend more on bilirubin, and then we go towards enzymes, and we find whether how enzymes help to reach to conclude a disease process. So ये इतना सा ये तो anatomy है physiology की erythrocytes से ये हम पे खत्म कर देते हैं. Erythrocytes के जो dying or decaying cells RBCs जो अपनी life पूरी कर चुके हैं, biliverdin that becomes दो तरह की होगी, एक free और एक bound to albumin. Circulation में जब जाएगी ये तो bilirubin, heme and globin is a protein, heme जो है उसमें से biliverdin, और biliverdin जो है gets attached to the albumin and then it enters into circulation and then it goes to the hepatocytes. और उसके nucleus में जाके there is conjugation. You know the word conjugated bilirubin. Conjugation with glucuronides. तो conjugation के बाद ये conjugated bilirubin excrete हो जाती है. It goes into intestine और intestine में it becomes stercobilinogen. और जब ये when it is passed in the stool oxidize होके it becomes stercobilin. Some of this stercobilinogen is reabsorbed and goes into liver or into urine and is passed in the urine as urobilinogen, और atmosphere में जाके जब वो oxygen को catch करके it becomes urobilin. ये तो physiology थी. बहरहाल ये 3 लाइनें इसलिए लगाई हैं कि यहाँ से पहले तक जो causes इंजरी के हैं they are called pre-hepatic, और ये 2 लाइन्स के दरमियान the causes are hepatic and after it's post-hepatic. So jaundice is of 3 types: intrahepatic, hepatic, and post-hepatic. We will start it from here tomorrow morning. So come prepared with the physiology. Thank you very much. I'm sorry I could not give you time for questions because of some inconvenience in the lecture as well, and the connectivity of the voice which you could not reach. Thank you very much. Have a nice day. Okay. Yes, sir. You can see.
सर इसको जरा शेयर कर दीजिए. सर अपना नाम, टॉपिक और डिपार्टमेंट.
Music है? Wait क्या है?
डेट आज है सर 3.
हाँ.
3 5.